There's a particular kind of frustration that many men experience but rarely talk about openly. You finish urinating, wash your hands, and within minutes you feel the urge creeping back. Or perhaps you notice a few drops leaking after you thought you were done. Maybe your stream feels weaker than it used to, or it takes longer to get started. At first, it seems like a small annoyance. Over time, it becomes something you plan your day around. I see this scenario frequently in clinic. Men will often begin the conversation cautiously. "I'm not sure if this is normal," they'll say. "I just don't feel empty." Some assume it's simply aging. Others worry quietly about something more serious. What many don't realize is that these symptoms often share a common thread. The bladder may not be fully emptying. To understand why this happens, it helps to know how urination works when everything is functioning properly. The bladder is a muscular reservoir. As your kidneys filter waste and excess fluid from your bloodstream, urine collects in this storage space. When the bladder fills to a certain point, nerve signals travel to the brain, creating the sensation of needing to urinate. When you decide it's time, your body coordinates a carefully timed process. The bladder muscle contracts to push urine out, while the muscles at the outlet relax to allow flow through the urethra. It's a synchronized event, pressure from above, relaxation below. If either part of that coordination falters, urine can remain behind. In medicine, we call this a post-void residual. In everyday terms, it means you didn't completely empty your bladder. Sometimes this leftover urine causes obvious symptoms. You might feel persistent fullness, need to urinate again shortly after finishing, or notice dribbling. In other cases, you may not feel much at all, even though a significant amount remains inside. That silent retention can become problematic over time. One of the most common reasons for incomplete emptying in men is obstruction, something physically narrowing or blocking the pathway for urine. The prostate gland often plays a role here. Located just below the bladder and wrapped around the urethra, the prostate tends to enlarge gradually as men age. This condition, known as benign prostatic hyperplasia, is non-cancerous but can constrict urine flow. As the gland grows, it squeezes the urethra, forcing the bladder to push harder to move urine through a tighter channel. However, prostate enlargement is only one piece of the puzzle. Scar tissue within the urethra, bladder or kidney stones, and even severe constipation can interfere with emptying. Constipation is an especially overlooked factor. The rectum sits directly behind the bladder. When it becomes distended with stool, it can press against the bladder and disrupt normal mechanics. I've had patients who were surprised to learn that improving their bowel habits significantly reduced their urinary symptoms. There's another major category to consider. Sometimes the problem isn't a blockage, but a weak bladder muscle. Over time, especially if it has been straining against resistance, the bladder can lose its strength. Chronic overstretching from incomplete emptying may reduce its ability to contract effectively. Certain medical conditions such as diabetes can damage the nerves that signal the bladder to squeeze. Neurologic disorders or spinal cord injuries can also interfere with the communication between brain and bladder. Medications can quietly contribute as well. Common over-the-counter cold remedies containing antihistamines or decongestants may tighten the bladder outlet. Some prescriptions used to treat urinary urgency can, in certain individuals, make it more difficult for the bladder to contract fully. When someone tells me their symptoms began during a cold or after starting a new medication, that detail becomes very important. Why does this matter beyond inconvenience? Because urine that remains in the bladder creates an environment where bacteria can grow. Recurrent urinary tract infections in men are not typical and often signal incomplete emptying or another structural issue. Additionally, when the bladder becomes overly full, it may leak simply because it has exceeded its capacity. This overflow leakage can be embarrassing and confusing, especially when someone feels they have just urinated. The emotional impact should not be underestimated. I've seen men limit travel, avoid social events, or lose sleep because they're up multiple times a night. Poor sleep affects mood, concentration, and overall health. Some become anxious about being far from a restroom. What begins as a physical symptom can gradually erode quality of life. The encouraging news is that incomplete bladder emptying is often manageable once we understand the underlying cause. But before we talk about solutions, it's important to appreciate that this is not simply part of getting older that you must endure. It is a physiologic issue with identifiable mechanisms. In the next chapter, we'll explore those mechanisms more deeply, how doctors evaluate bladder emptying, what distinguishes obstruction from muscle weakness, and which evidence-based treatments can help restore comfort and confidence. When a man describes the sensation of incomplete emptying, The next step is not guessing, it's investigating thoughtfully. Bladder symptoms can overlap, but the reasons behind them differ. Understanding whether the issue is obstruction, muscle weakness, nerve dysfunction, or a combination of factors guides everything that follows. The evaluation often begins with a detailed conversation. I'll ask about the strength of the urine stream, how long it takes to start, how frequently urination occurs during the day and night, and whether there is dribbling afterward. We discuss medical history, including diabetes, prior pelvic surgeries, back injuries, or neurologic conditions. Medications are reviewed carefully, including non-prescription cold remedies. Sometimes the smallest detail, like a new antihistamine, can explain a sudden change in symptoms. From there, objective testing can help. A simple bladder ultrasound performed after urination measures how much urine remains. This painless scan gives us a number known as the post-void residual. A small amount of leftover urine can be normal, especially as we age. Larger volumes suggest that emptying is incomplete and need further evaluation. If the residual is elevated, the next question is why. In men over 50 or 60, prostate enlargement frequently contributes. The prostate surrounds the urethra like a collar. As it gradually grows, it narrows the channel for urine flow. Early on, the bladder compensates by contracting more forcefully. Over time, that extra effort can thicken the bladder wall and reduce flexibility. Eventually, even strong contractions may not overcome the resistance. But obstruction isn't limited to the prostate. Scar tissue within the urethra, often from prior infections, trauma, or procedures, can restrict flow. Bladder stones can intermittently block the outlet. Even chronic constipation by crowding the pelvic space may mechanically affect emptying. The body's structures are closely connected, and small changes in one area can influence another. In contrast, some men have little obstruction but still struggle to empty because the bladder muscle itself is underactive. Think of the bladder as a pump. If the pump's wiring or muscle fibers are impaired, it cannot generate enough force to push urine out completely. Diabetes is a common contributor because elevated blood sugar over time can damage the nerves that coordinate bladder contraction. Neurologic conditions such as multiple sclerosis or Parkinson's disease can interfere with signaling pathways between brain and bladder. Even long-standing obstruction can eventually fatigue the bladder muscle. Treatment depends on identifying the primary driver. If prostate enlargement is significant, medications are often the first line of therapy. Alpha blockers relax the smooth muscle around the prostate and bladder outlet, reducing resistance and improving flow. Other medications gradually shrink prostate tissue over months. In more severe cases, especially when infections, kidney problems, or repeated retention occur, minimally invasive procedures or surgery may be appropriate. These interventions remove or reduce obstructing prostate tissue, allowing urine to pass more freely. When constipation is part of the equation, bowel management becomes essential. Increasing fiber intake, staying hydrated, and engaging in regular movement can improve stool consistency and frequency. Addressing constipation may seem unrelated to urinary symptoms, but in practice, it often provides meaningful relief. For men with underactive bladder muscle, strategies focus on maximizing efficient emptying. Timed voiding can prevent overdistension. Instead of waiting for an urgent signal, urinating every 3 to 4 hours keeps bladder volumes manageable. Double voiding, waiting briefly after finishing and attempting again, gives the bladder a second opportunity to contract. These approaches may sound simple, but they align with bladder physiology and can reduce residual urine. Body position also influences mechanics. Sitting down to urinate encourages pelvic floor relaxation. Leaning slightly forward can alter the angle between bladder and urethra in a way that facilitates flow. Deep, diaphragmatic breathing reduces pelvic tension. Straining, on the other hand, often backfires by tightening the very muscles that need to relax. Pelvic floor dysfunction deserves particular attention. Many people think only about strengthening exercises, but overly tight pelvic muscles can impair urination. Gentle stretching of the hips, lower back, and abdomen can complement bladder-specific strategies. When muscles surrounding the pelvis relax appropriately, the outlet opens more easily. Hydration remains important, even when frequency is bothersome. Concentrated urine irritates the bladder lining, increasing urgency. Maintaining pale yellow urine is a practical goal. At the same time, limiting large fluid intake in the hours before bedtime may reduce nighttime awakenings. Certain dietary triggers can exacerbate symptoms. Caffeine and alcohol stimulate bladder activity. Spicy foods, acidic beverages, carbonated drinks, and artificial sweeteners may worsen urgency in susceptible individuals. Tracking intake alongside symptoms can reveal patterns unique to each person. Weight management is another evidence-based tool. Excess abdominal weight increases pressure within the pelvic cavity, which can worsen urinary symptoms. Even modest weight loss has been shown to improve frequency and urgency. While many cases improve with these measures, some require closer medical supervision. Persistent high residual urine can strain the kidneys over time. Recurrent infections, visible blood in the urine, or inability to urinate at all demand prompt attention. Acute urinary retention, when someone cannot pass urine despite a strong urge, is a medical emergency requiring immediate relief. The key message is that incomplete bladder emptying is not random. It reflects underlying mechanics, either resistance at the outlet, weakness of the muscle, nerve miscommunication, or contributing lifestyle factors. Once we understand which elements are involved, treatment becomes targeted and effective. In the final chapter, we'll bring these insights together into practical daily guidance, focusing not only on symptom relief, but also on preserving comfort, independence, and confidence over time. When urinary symptoms begin to shape your routine, when you're mapping out bathrooms before leaving the house or waking multiple times a night, it's more than a minor inconvenience. It becomes a quality of life issue. Sleep disruption affects mood, energy, and even heart health. Avoiding social gatherings because of fear of leakage can quietly shrink your world. The good news is that many of these symptoms are manageable with consistent, thoughtful steps. Let's start with what you can control today. One of the simplest but most overlooked strategies is allowing enough time to urinate without rushing. Modern life trains us to move quickly, but bladder emptying works best when the body is relaxed. Sitting down to urinate, even for men who typically stand, can reduce tension in the pelvic and abdominal muscles. When your feet are flat on the floor and your posture is slightly forward, the pelvic floor is more likely to relax fully. Urination should feel like a coordinated release, not a forced effort. Breathing plays a powerful role in this process. Slow, diaphragmatic breathing, where your abdomen gently expands with each inhale, encourages pelvic floor relaxation. Straining or bearing down often tightens those muscles instead, making it harder for urine to flow. Giving your body 30 to 60 seconds to empty naturally can reduce post-void dribbling in the sense of incomplete emptying. Double voiding is another helpful technique. After finishing, remain seated for a short period and attempt to urinate again. Sometimes standing up briefly and sitting back down can stimulate a second contraction. Gentle movement or subtle rocking may help shift residual urine toward the outlet. These small adjustments, practiced consistently, can meaningfully reduce leftover urine. Bowel health remains essential. Chronic constipation can worsen bladder symptoms by crowding the pelvic space. Ensuring adequate fiber intake, drinking sufficient fluids, and staying physically active support regular bowel movements. If necessary, over-the-counter stool softeners can be discussed with a healthcare provider. Addressing bowel function often improves urinary comfort more than patients expect. Hydration should be balanced, not restricted excessively. Dehydration concentrates urine, which can irritate the bladder lining and increase urgency. Aim for urine that is light yellow. However, moderating fluid intake 2 hours before bedtime can reduce nighttime awakenings. It's about timing and balance rather than drastic restriction. Dietary awareness can also make a difference. Some men find that caffeine, alcohol, spicy foods, acidic beverages, or carbonated drinks worsen urgency. Instead of eliminating everything at once, observe patterns. A brief symptom diary can help identify personal triggers and guide adjustments tailored to your body. Weight management deserves mention again because it has measurable impact. Even modest weight loss can reduce abdominal pressure on the bladder and pelvic floor, improving urinary frequency and urgency. Regular exercise not only supports weight goals, but enhances overall circulation and nerve health, both important for bladder function. Pelvic relaxation exercises can complement these efforts. Gentle stretches that open the hips, lengthen the lower back, and release abdominal tension can indirectly support bladder emptying. Many people focus on strengthening, but balanced flexibility is equally important. When pelvic muscles are overly tight, they may not release properly during urination. At the same time, it's important to recognize when symptoms require professional evaluation. If you are waking frequently at night, limiting activities because of bathroom access, or feeling anxious about leakage, it's time to speak with your doctor. Treatment options range from medications that relax the prostate or bladder outlet to minimally invasive procedures when appropriate. No one should feel resigned to chronic discomfort. Certain warning signs should prompt immediate care. Inability to urinate despite a strong urge, especially with abdominal pain, requires urgent attention. Blood in the urine, fever with urinary symptoms, or repeated urinary tract infections also warrant evaluation. Early intervention can prevent complications and protect kidney health. Most importantly, remember that bladder symptoms are common and treatable. They are not a reflection of weakness or personal failure. The bladder is a dynamic organ influenced by muscles, nerves, hormones, and daily habits. With understanding and support, many men regain control and confidence. Improving bladder function is often a gradual process. Small changes practiced consistently, relaxing during urination, managing bowel health, staying hydrated appropriately, maintaining a healthy weight, add up over time. For those who need medical therapy, safe and effective options are available. You deserve restful sleep, spontaneous outings, and peace of mind. Addressing urinary symptoms is not just about reducing inconvenience, it's about preserving independence and comfort in everyday life. When you listen to your body and seek guidance when needed, you give yourself the opportunity to move forward with greater ease and confidence.